Well, joining us now is Jeffrey Schlegelmilch. He's director of the National Center for Disaster Preparedness at Columbia University's Earth Institute. Thanks so much for coming on the show.
Thank you for having me. I appreciate it.
Of course. Now, we weren't at all prepared for this pandemic 6 months ago. How would you rate where we stand now, and in particular, China's ability to stave off another wave of infections?
Well, I think globally we're still in a very, very precarious place. We see really incredible transmission of the virus in the United States, where I am, and other parts of the world. Certainly the data coming out of China is very encouraging, and it does demonstrate that it is possible through sound evidence-driven policy that it is possible, but it's also a cautionary tale that just because you're not detecting it doesn't necessarily mean that it's not transmitting, and something this infectious and this deadly can get out of hand very, very quickly. So no matter where we are in the world, I think it's important not to let our guard up. We're a long way from being through this pandemic.
And as you also mentioned, some countries are doing a better job bringing infections under control, others aren't. Why? And, because it really appears that it doesn't matter how rich a country is when it comes to dealing with this pandemic.
Yeah, science is science, and it doesn't care if you're rich or if you're poor. And I think that that the countries that are really letting the science lead and letting the policies be informed by the best available evidence, and that's a moving target because we're discovering new dynamics and new things about this disease every day, but those are the ones that are doing a better job of containing this virus. And as a consequence, are going to have more options for opening their economy, lower deaths, and better outcomes all around. Those that are not, that are leading with politics, that are denying the existence or fomenting different political divides as a result of this, are having a much harder time getting it under control because they're not focusing on the data, not focusing on the evidence, and letting that lead the way in terms of how to best fight this pandemic.
So that's what's happening individually. What's your assessment of the global effort to fight the pandemic? Is there enough cooperation, coordination between countries?
Like so many things, it seems like we're living in two worlds simultaneously. So on the one hand, there's really unprecedented collaboration and data sharing in certain areas, particularly when it comes to treatments and among pharmaceutical companies and things like that. While at the same time, we're also seeing, countries blaming each other for this instead of trying to really work to get it under control. We're looking at, even in the U.S., withdrawing from the World Health Organization, which certainly has its problems, but really there's no alternate in terms of a global forum for coordinating this. So I think you can make the argument either way, but the reality is that, we are seeing some good things come out of this with collaboration, but we're seeing some things that are really harming our ability to fight this globally and harming folks to come together on this. And again, it's when it's driven by politics rather than science is where the worst of the response comes out.
Right. And also on the science, one of the most frustrating things for the public is just the sheer amount of information. It can get overwhelming, but at the same time, how much we don't know. Is it an airborne disease? Can we develop an immunity? How do we navigate through all of this?
The best advice that I can give for most people is to actually not try and keep up with all the information that's out there. Every study is getting a press release, but science is very incremental. It has to be replicated. It's slow. It's moving faster than it has before, but it's still inherently slow. And I would work backwards from what is it that you need to do. If you're looking to protect yourself, does it matter, if it's airborne for, 6 feet or 8 feet? You want to try to stay distant from people, wear masks when you can't stay distant, all of these things, these layers of interventions that we put on. And I think that we then get to a place where we can sort of manage within the uncertainty a little bit when we work backwards from what are the steps and layers of steps that we can take to protect ourselves while we wait for more information to become available. But if you try and track every study and every clinical trial and everything that's out there on a real-time basis, it's just going to make you crazy.